To somebody who is interested in getting into healthcare tech, what's the one piece of advice you would give them?
Do not skip steps. Substance abuse and addiction, mental health, it's a situation that needs a lot of attention.
Hi, it's Adam Silverman, the Chief Medical Officer at Syllable. And if you're here looking for Can Silicon Valley Save Healthcare, well, you're sort of in the right place. We are launching today our new podcast called Solve. And our inaugural guest on today's podcast, we're very excited to have, is Paul Joyner. Paul is the CEO of Kipu, which is in the behavioral health space, and I'm going to give him a chance to introduce himself and Kipu to the audience. Paul and I had the opportunity to meet through Joe Blundo of TCV at Vive last spring. And I thought that he would be a great addition to the podcast for Syllable. And today we're very happy to have you. Paul, thanks so much for joining.
Yeah, thanks, Adam, for having me here and the inaugural on the new Solve.
Yeah, you are the first guest, so right. You're going to set the bar for everybody that's coming after you.
Good.
So tell us a little bit about yourself and your journey, how you got to Kipu, and then tell us a little bit about Kipu.
Sure. So I started my career. I'll just go a little bit through my career progression, and it kind of sets up to why I joined Kipu. My father was a big healthcare person. We got tied into Nashville, and he sold a business there. And so I was going to be a hospital administrator because in Nashville, there's a lot of people that go into management of facilities, all sorts of facilities. So my dream was to be a hospital administrator. Well, I got this opportunity to work for a firm and where we helped non-for-profit health systems open up hospitals. And the idea of the firm is we would come in and assist you use technology and apply technology in your new facility. The thought process, why are you going to build this beautiful new building and just port over all your old processes and technology and your hiring practices and your training practices? Use your new facility as a ground to test new technologies and approaches to innovate, move forward. Because this is the very early stages of EMR adoption in the early 2000s. And so I opened up 2 hospitals, unbelievable experience, and it really set up the rest of my career. It was a very blessed opportunity to be able to do that because I got to solve the patient perspective, the workflow, system selection, implementation. But I deviated to capital markets, and then now for the last 15 years, I've been, in the capital markets world. I lend money to rural hospitals, and I was also a sell-side analyst for Jeffrey and covered healthcare IT services. The last 15 years, I've been in operations, in various revenue cycle management company and healthcare IT services businesses. Most recently, I was a COO of Availity, which is the largest provider network sponsored by health plans. And so the way I think about it is we were the front door provider portal for the vast majority of large health plans in the country. 42%, I think at my left is like closer to 45% of all covered lives, 1.5 million logins a day. And then we also had the largest data exchange network between the providers and the health plans. And we had other provider businesses and payer businesses, and I managed both the provider and the payer business. So I got a really unique perspective and front row seat between the tensions and also some of the attempts to solve some of the tension between providers and health plans. And I really enjoyed that. But I made that run, and there was a transaction last year, and it gave me an opportunity to look at new opportunities. And that's how I came up to Kipu. And I selected Kipu because I was blessed with multiple opportunities to go stay in revenue cycle, or there was a genetics opportunity. There was a couple of other interesting businesses where I could go lead. I chose Kipu because for 3 primary reasons, and it sets up the problem we're trying to solve. Mm-hmm. Number 1, I wanted an investor in a business that was willing to invest in growth, which TCV was. 2, I wanted to join a cause and more of a mission oriented than just revenue cycle or just having to deal with traditional medical care. And so we are the leading EMR. Kipu is the leading EMR in substance abuse and addiction treatment facilities and providers. And it's a space, sadly, that is in high demand to do more for more people. It is a space evolving very, very quickly. and I'll come to that in a minute in terms of the problem we're trying to solve,
Yep. Yep.
and the problems that I walked into that I didn't even anticipate, showing up to a new niche within healthcare. And, I've viewed almost every segment of healthcare, but participated in some form or fashion, everywhere from logistics of taxi cabs, getting elderly to care, to DME and dialysis and whatnot. But I've never ventured off into the substance abuse and mental health area until with Kipu. And it's a great opportunity to make some advancements and really help a lot of people. So the mission. And then the third reason why is I wanted to go to a growth phase.
Mm.
Right. And I think you can appreciate that with Syllable, right? It's like
Yep.
there's something about businesses that still are just a little teenage in how they operate, or a little just a little naive, and a little bit moving towards how they should perform and behave, and not all the way there, because then you get to shape more and you get to think a little bit harder. And then the pressure of trying to do that with a limited number, and to advance and achieve a bold vision with a limited number of resources is really important. I will say this, going back to your last series, I know this is the new series, Solve. One of the biggest problems I always saw, especially when I was following it very closely when I was a sales side analyst, the worst thing you can do to an innovative healthcare IT company is overcapitalize it.
Mm. Interesting.
Because it's too tempting to get too many things started, and you make everything too big and not be specific enough. Also, the end market in terms of the buyers, there's only so many people who can buy your solution. There's only so many large health plans and large health systems, and so you can quickly overcapitalize an idea. With Kipu, though, with TCV and the way we're investing in this business, as a leading EMR, we also have a CRM solution, or customer relationship solution, for our customers to work with their patients to get them into their facilities or treatment programs. And then we have a billing platform that specializes in billing for mental health and substance abuse. The problem that we're trying to solve with Kipu is be the EMR to help our customers go through the journey that home health went through, that DME went through, that other niches within healthcare went through, where it was high out of pocket, more out of network claims. Moving in networking and working with insurance companies drives consolidation. It also forces sophistication, and it also forces you to manage patient care across the levels of care more quickly and more frequently. What I mean by that is that in substance abuse, you go from detox to inpatient to outpatient, and then alumni care, because it's a lifelong journey. We're working on solving the problem of how do we help our providers move the patients to those levels of care, the care continuity, the continuum of care, and the data and information to support that there's a good outcome through all those levels of care, and that the patient relapse rate is improving, and that the patient's quality of life post, and once in the recovery, remains high. And,
So,
and there's
Paul,
a myriad of opportunities there.
Let me interrupt you for just a second, because I think this is really interesting. I thought where you were going was that behavioral health was in need of a platform that enabled care, that it sort of enabled the delivery of care, enabled the business of care. So everything from documentation to revenue cycle management. But it was interesting. You started to talk about access to care, because you described the problem of how many people actually need behavioral health or substance use treatment, and the unfortunate fact that a small number actually get there. So describe the problem a little bit more for me. Is it more about creating a repository and supporting the business of care, or is it really more about enabling access for patients?
It's more about enabling access and portability of patients to the appropriate care setting.
Okay.
And that's us just saying, let's just take for granted that you can always file away a patient's data in a database, and you can always work on improving the data models, the attribution models, the pinning of the data. But you can never lose sight of how difficult it is to work with providers to, one, make sure the patients get into the right care setting, and then two, make sure they get there with the right information, so that the provider is as less stressed as possible and can get to the point of delivering care faster. Yes, you are right. We need to invest in the underlying, and we are aggressively investing in Kipu to support the underlying business processes. Yes, but that's a means to the end. The end is access to care and helping the patients and the providers match where that patient needs to be in the care journey.
So when you talk about EMR, I think and solving a problem around EMR, why is there a niche for Kipu? Why is Epic not solving this? What is not appropriate about the larger health, predominantly utilized EMR is sufficient for behavioral health needs?
I think in the broader behavioral health with psychiatric care and more medical oriented behavioral health categories, you will see some of the larger EMRs invest in behavioral health care components. I also think you'll see more primary care centric EMRs offer and extend mental health capabilities within their EMR platform, because so much of the primary care doctor's office is centered around mental health
Mm-hmm.
and behavioral health. But for substance abuse and addiction treatment, eating disorder, and some of the trauma recovery and et cetera, there's very specialized assessments and there's a very specialized narrative that needs to happen when you're assessing a patient into care, when you're treating them through a care plan, and you're documenting and assessing them along the care journey, and when you're assessing them upon discharge. It's very specialized and unique to those disease categories and opportunities to move people to a better place or into recovery. So it's a niche down market. So it's a below the radar. And then once you get below the radar into the space of substance abuse and addiction, it's a very specific set of criteria and information and dialogue between the provider and the patient and a care program that the other EMRs just don't support very well.
And as you mentioned, for folks that aren't familiar with the way substance use care occurs, you mentioned it earlier. It's across multiple modalities, if you will, or multiple locations. There's a spectrum of care that's not just inpatient and outpatient. It's actually, there's sort of hybrid, inpatient settings, there's hybrid outpatient settings. And it sounds like what this is enabling you to do is to capture the full patient journey across those various environments. Is that right?
That's 100% correct. And what's the highest, lowest cost, highest quality experience that you can match based off the assessment of that patient and with the right provider? There's some providers that believe that they can quickly get somebody through detox, getting the poisons out of their body and get them stable enough to where they actually will thrive better when they call intensive outpatient, where the patient goes home in the evening and spends 5 days at a facility or in a program and then goes home at night. There's some providers that like, no, we need to get this adolescent into a 60-day program and send them away, right? So it's not a one size fits all. We're unique individuals. Everybody's unique, and there are multiple modalities and paths. And then we're seeing a just tremendous, talking about your concept of solve. There are a lot of providers with really big hearts that are investing heavily in telehealth and digital platforms to engage patients. And we're investing in that as well. And we're also investing alongside of some of our customers where they're trying to use digital aspects of it to provide care in the down times when the patient's not at their outpatient facility or in the evening in between visits with their care provider. And so we've seen this is an interesting stat. It's a little bit of duplicate accounting because the way Zoom counts minutes, but we use Zoom integrated in our EMR for telehealth, and we've now do over 1.5 million minutes a month.
Wow.
From zero.
Wow.
And that was over in roughly a 24-month period.
Tell me a little bit about sort of success stories. I won't say success metrics because you mentioned minutes, and I'm sure users and revenue are all measures of success. But give me the before and after when you install Kipu's EMR. What are providers saying? What kind of feedback are you getting from patients that sort of reinforce the work that you do on a day in and day out basis?
What really motivates me is when every EMR has its issues, right? And so I get complaints, obviously, but the stuff that really motivates me is there's a lot of before and after. We have a lot of data to support this. I mean, our NPS score is up around 40%, up around 40. We have a tremendous following in our niche market. We're the market leader by 2 or 3x. And what really motivates me though is when I hear the story around, I used to spend hours tracking down patient information. I used to spend hours in the evening documenting patients, and I used to, not be able to get full reimbursement for my care. And I also couldn't collect quality measures. When I hear these, what I used to not be able to do, what I can do today, that's very motivating. And more importantly, staff turnover rates going down, improve quality of care. And then the collection of data. And what I'm most excited about is coming down, and we're working really hard on right now, is I think we could really invest in our data and keep it. We have 125,000 active patients in our EMR, concurrently in our EMR every month. That's a lot of data information that I think working with our providers, we can benchmark and we can start to show what are true best practices and what are true best. I think we can apply a lot of analytics around solving that problem and matching patients with the provider. So in the nutshell, the before and after picture is this. It used to take me a lot of time to treat, and it took time away from the providers, my patients, because either I had an inefficient EMR or I was a mix between EMR and paper. I put in Kipu or put in an EMR that works for me that returns time back to patient care. It lowers my staff turnover and allows my staff to be more productive and work with me. That's number one. Number two, it's opening up a door of opportunity that now that we have all this data on all of these patients that we can work. Substance abuse and mental health is a place where there's not a lot of benchmarking. There's not a lot of analytics in play right now. And there's a lot of legacy ways of trying to determine what's best practice. And I think with the data coming available in our EMR, I think we're going to be able to shine a light on that in the coming years.
That's great. Where did the name Kipu come from?
It's the original founder came up with the name, and it's a Native American record keeping system.
Okay, interesting. So tell me a little bit about the journey since you've been there. You've outlined the extent of the problem and where Kipu fits in the solution, but talk about what the journey has been like and what some of the biggest challenges for you and the team have been lately.
So day one, I realized that we were behind the pace of our customers trying to become more sophisticated, trying to use technology, and trying to evolve their care models to address the increasing demand, the pressure from outside forces, external forces on a provider to treat patients across the different levels of care more effectively, and the pressure to get more data and become more sophisticated and basically mimic and be more in line with the mainstream medical providers. And for my first job as a CEO, I was trying to figure out, I had to articulate to the company, we have to be across all levels of care. We were really, really strong in detox and residential treatment. We need to become very strong across the full continuum. So that was number one. So number one was get everybody focused that we got to move across the care continuum. Number two, I was like, look, our customers are moving very fast. They're consolidating. They're hiring professional healthcare leadership. They're investing heavily in their operations. We need to catch up from a technological perspective. And the first place we needed to do that was interoperability. So we've invested heavily in interoperability. Next is we needed to figure out how do we organize our data for our customers. And that's what we're in the process of doing right now, is really organizing the data for our customers. The other thing I would just say, for those that are running businesses that listen to this podcast, there's an expression that I picked up along the way where it's like talent, strategy, and risk. We've worked really hard on keeping the people at Kipu that made it great, as well as bringing in new talent. So talent, number one. The strategy is the full care continuum. And then I've spent a big chunk of my time working on managing the risk. What do we need to pay off in the technical debt? What do we need to do to compete against our competitors in terms of providing better data and tools to our customers? And so it's a pretty basic formula, but get good people, keep good people, get them focused on a vision of the care continuum, and then try to minimize risk. And the way I view risk is that, are we doing the right things and are we doing them in a timely manner? And so the number one thing I'm most proud of over the last year is that we have really increased the velocity, our say-do ratio. We say we're going to do something for our customers, and our time to get it out to our customers is really shrunk and really narrowed. What I'm a little bit disappointed is what I would call more of the true frontier innovation curve. You take something like you're trying to achieve at Syllable, where you're trying to use voice. I think voice ambient devices is a big opportunity in our space. I think AI and assistance with documentation is a big opportunity. Getting more granular on the data. So there's some of those more futuristic, bigger innovation boulders that I hope to attack next year. This last year has been about vision, getting the right talent in place, catching up a little bit on the strategy front, and improving the organization's ability to deliver technology.
So I'm curious on your take on the vision piece, because your experience, as you outlined at the beginning, you've had experience across the continuum throughout healthcare. So you see how it works well, and you've also seen how it doesn't work as well as perhaps it should. And one of the things that I spent 30 years on the provider side. So as a general internist, I was in private practice. I had an academic part of my career. I was a physician executive for a large health system for a period of time. Um, but and I had been I had been sold by, probably hundreds of vendors over time who wanted me to buy a product from them. And it wasn't until
Right.
I came over to the vendor side that, I really began to do a more objective evaluation of how health systems buy things, and or how in health systems writ large. It could be a practice, it could be a hospital, it could be a large health system. But it as we think about innovation and we think about all the really cool things you mentioned, AI, you mentioned big data, and things like that. The In my estimation, health systems are still sort of 1970s in their approach to being able to utilize technology. And I don't mean that in a denigrating way. I just mean the way that they have their processes and their policies, even down to the level of procurement. It's not set up to grasp on, purchase, and then scale the types of innovations you were just suggesting. So I'm curious if you would agree with that statement, and if not, how you
100%.
clarify that.
Yeah, in my prior roles, I've worked with the largest health plans, largest health systems, and if you want to get into it, I can get into procurement departments, both, and where I think they go awry. Well, we'll go on one sidebar there. I love the fact you're bringing up procurement because it's so true, and from two fronts on both large health systems and large health plans that struggle with this. Some leader thinks they need a solution, and they often don't take the time to survey, does that solution already exist within their organization in another area? So can they force multiply dollars by partnering internally on a technology solution? That's number one. On the procurement side, there's been so much effort on procurement processes. They negotiate to the dollar only and not to the purpose of the value proposition. And so I made a point in my last role where I would not negotiate if the person that's making the executive decision is not involved in the procurement process.
That's great.
I walked away from a 9-figure contract, walked out of the room with them because I knew that if the executive sponsor heard what they were trying to get us to agree to in our contract, that they would not be very happy once we started implementation. Right. So there is this whole process thing. But going back to kind of your main question, which is, I agree with you 100%. And I will say one of the things I'm most excited about is that within our Kipu's customer base, yes, they have a lot of things stacked against them in adopting technology. Not the largest IT organizations. Sometimes IT organizations zero, right, or more times than not, are a growing IT organization. It's not. These are people that care about helping people with addiction. A lot of our customers are in recovery themselves, and they're very mission oriented, and they don't have a lot of capital. They have growing pockets of access to capital, but they don't have a lot of capital. Despite all those things stacked against them, the fact they are so mission oriented, they're not big bureaucracies, and they're also too trying to do this in an era where the digital footprint of their patients is what's very high. Their digital footprint as an individual is a lot higher than I would say the legacy processes that health plans and hospitals grew up. So I think the timing is really going to help us too. So from a Kipu's perspective, we're going to benefit from, they're so mission oriented. They're not bureaucracies yet, right? The lawyers and accountants and such have not showed up just yet. And then the timing of it being such a digital age. If you're an addict in your recovery, you have a phone, most likely. Just even if your economic status is not that great, they still find a way to pay for a phone, and that phone can be a digital experience to keep you from relapsing, right, in your
Yep.
hand. And that's something that our customers can leverage. Going back to the broader healthcare ecosystem, I do have an opinion on that, and I want to add one more thing, just since you gave me the microphone on it.
Absolutely.
And I'd be interested in a question,
Yeah.
which is, one of the things I noticed, and it really frustrated me, was the way that leaders in hospitals and health plans are compensated is too short. To make them use technology in the right way and to implement it with the proper change management, it's got to work on a plan beyond the current year's bonus process and the current year's finite budget process. Hospitals and health plans have to think they build these 5-year strategic plans, and then as soon as they're done with their strategic plan, they break it down into an annual project, draw a stake in the line, often way too aggressive, and that starts to create it. And then they pervert the incentives on how they bonus people and compensate people within that 12-month period. I mean, to effectively implement technology, you got to put it over a time, and I see that all the time. And I saw that it was really sad because I saw a lot of great people in health plans with a lot of great ideas, but they were working on such perverse timelines and incentive structures that there was no way they were going to follow through. So what you ended up with, and I'm sure you saw this in your time, a whole sea of pilot projects. I mean, just a vast sea of pilot projects. And then as soon as you have a success, everybody's like, wow, that pilot there was really successful. The way they built that pilot had so many band-aids to make it a success that once they try to roll it out across the rest of the organization, it fails.
Or once they hand over the budget for the pilot from an innovation group to the frontline operator, the frontline operator says, I don't want to pay for that, or I don't have the budget for it.
I don't have the budget for it, or they layer in so many additional expenses and controls, it just makes it cost prohibitive.
So before we dive too deeply into the pessimism of the status quo within healthcare, let's flip it and say, so with that as reality, how does Kipu and how does your leadership team address those particular issues? Are there things that you do in your conversations with customers in your sales cycle or in your implementation that sort of helps to insulate you from some of that?
So, I mean, you might, I don't think you can fact check me live here on the show, but you can fact check me if you want the background and follow up. But my sales approach is probably the most blatantly transparent that there is in healthcare. I mean, I did this with large health plans, and sometimes my boss would be like, I can't believe you just said that. And I said, well, it's going to work because it's so, I said, because you can't argue against it. So the truth will set you free. So I am very clear in the last year that it's okay to admit that we're not good at something as a company, but here's what we're doing about it. Or we're not able to do that today. And frankly, none of our competition is, and really what you're trying to get at is X, like when a provider asks for something, right? And then also I'm very clear about, even if we could do that for you, explain to me again how you're going to simulate that data or process into your organization. Where's your change management? Are you set up for success in adopting technology? So I think number one is culturally, you have to be comfortable having the uncomfortable conversation about honestly what we can do as a provider and as an EMR, and not overstate ourselves, not just get the deal, not be transactional in nature, but be more long-term thinking. I think Epic did a good job of this when they were really taking off, right? They put a little bit of a, no, customer, you don't select us, we select you mindset. And I think the more of that honesty around, are you ready to implement technology provider, is a good thing. The next thing is what really gives me hope more than anything is the pressure to change and to actually use technology has never been this high. Yeah, you could say back during 5 or 10 years ago, there was a lot of pressure to implement technology. There weren't. Right. Free cash flow was still decent across the board. There was still buying time. There was leadership, still had the excuse. There was still enough excuses on the table. Most of those excuses are being removed. One, because the way technology showed up in your personal life. Two, financially, they had no choice but to turn to technology. And then three, the patients are about to revolt, right? If the providers don't get better in terms of use technology. And I think, remember, every patient is also a member of a health plan. And so I think patients and members, whatever hat they're wearing, I'm paying you health plan to help me with care, or, hey, provider, I'm trusting you to take care of my care, whatever hat the patient or member is wearing, I think they're really close to looking at, why are you relevant to me? And why can't I just go direct to this person that is using technology? So I think the competitive pressure from the patient and member is going to increase.
Yeah, I think the two pieces of that I want to pull out. I mean, your comment early on about overcapitalization, and then the tendency for young companies to try to please the customer and say yes to everything, I think are huge obstacles and huge lessons that anybody coming into, this is about healthcare technology, so anybody coming into healthcare technology, but I'm sure it pertains to any other technology company, is you can't be all things to all people. I mean, maybe you can in the future, but it's not going to be today. And the more of a war chest you have, it enables you to do more things that can be distracting. And if you don't have some sort of sifting or sorting process with your customers, you're going to spend your time spinning wheels with a lot of conversations that don't end up, getting you anywhere. So I think that
Right.
that's really interesting.
And you got to sell your customers a vision
Yes,
too, by the
exactly.
way. That's where a lot of, I think, smaller companies also kind of miss the boat.
What gets you up in the morning, other than the alarm clock and your dog or whatever else it might be?
The, um, I think from a professionally, the motivation, I wake up in the morning, I probably have, my personal motivations, my professional motivations. My biggest, professional motivation, so it's interesting. When I was at Availity, what got me up is I think a big part of the problems in healthcare and a lot of cost and waste sits between the way providers and health plans interact with each other. So that's one of the reasons why I went to Availity. So I went to Availity because it was the best seat to have the dialogue between the providers and the health plans and affect that. And there's a lot of great people at Availity. Avality's hired another slate of really good executives to continue that cause. And we made a big impact when we were there. At Kipu, this is a mission, substance abuse and addiction, mental health. It's a situation that needs a lot of attention. It's very rewarding to help people that are so mission oriented. Our customers are very, very mission oriented. When you go to one of our conferences, you get more hugs than any other healthcare conference. Right. These people care about human beings because many of themselves, face death and really life challenges in their own right. So what motivates me more than anything is that this is a space that needs help. It needs ideas that have been tried in other segments of healthcare brought into it, right? It needs to connect. It needs to create an umbilical cord back to the broader healthcare system. I mean, one of the things that was really exciting for me is I just got an email today from a client. It's like, we're going to partner with a primary care clinic. Can you get them data? Right? I mean, that's exciting. That's exciting opportunities. So the biggest thing that gets me up in the morning is that I feel really excited about a mission, and I feel really excited about the growth profile of our company. And, with growing company, you get the opportunity to really create buzz and energy that there is hope. And so the last thing I would say is I think we're giving hope to our employees that we can make a difference. I think we're giving hope to our customers that there's a technology company paying attention to them. Because I will say, one of the other things I noticed when I got here, a lot of our customers don't feel like there's a technology is not paying attention to them.
They're not.
Right? They're being ignored.
It's like the forgotten.
Yeah,
it's the forgotten part of healthcare. Nobody wants to really shine a light on addiction and behavioral health.
Yeah, and so that's a really exciting piece. And it's getting more attention. Your last series around Silicon Valley. There's a lot of people from Silicon Valley showing up saying, "Hey, we can solve mental health." There's some good ideas out there, but it's really rewarding to be in this niche, and to be quite frank, to be under the radar of some of the mainstream players, right, who have all gotten so big and have their own kind of issues of being so big.
So last question for you, and then I'll let you get back to the rest of your day. If you were talking to somebody who was interested in getting into healthcare tech, what's the one piece of advice you would give them?
Well, I have two pieces of advice, depending on if it's a technologist, right, and developer and engineer. I would say do one tour of duty with the provider organization. You don't have to stay there long, but if you really want to make a difference, you got to go. You got to build empathy, because then I feel like that will bring down their thinking to a more pragmatic state that building software to influence a workflow where one human being is trying to heal another human being is not as simple as you would think. It's a very complex, processes, and you got to build a lot of empathy to understand that. So that'd be if you're a technologist. If you're a business leader and you're one day your goal is to enter healthcare, start, find, and be a senior executive in healthcare, do not skip steps.
What do you mean by that?
You have to go through the career progression. Right. Don't think just because you're very capable and you have the skills to be a, off the chart leader, take the time to learn and go through the process of learning all the different roles and learn all the different elements of serving a healthcare marketplace. Because the biggest thing that most healthcare investors miss and where they get awry in healthcare executives is presumption. I'm not going to name any names, but there are 4 or 5 entrepreneurs that I know that in healthcare that raised a lot of money, and all but one monetized pretty well, but didn't really do anything. Right? He just kind of sold an idea more than anything. Most of them fell on their face because they were so presumptive about who would buy it and how much they would pay for it and how much they would pay for it over time. And then also what it takes to attract and sustain people in the mission of healthcare, because, and that's my last piece, is the reason why I say don't skip steps is because you have to learn that this industry, unlike Wall Street, or more than Wall Street, I would just say, which is this industry is unbelievably inefficient in the short run term and shockingly sometimes efficient in the long run. And what I mean by that is you can say what you want about how messed up healthcare is, but the actual outcome of a cardiac event is way better now than it was 30 years ago. Now, today, there's a lot of messiness and a lot of bad stuff happening. So it's terribly efficient today. But on the big boulders and the big things that we're trying to achieve, healthcare has achieved some things when you look at it over a longer time, right? And so to do that, you got to build a career and you got to work for people and leaders that can mentor you and develop you. Don't skip steps. Don't just think because you did a tour duty at this rocket ship that achieved an 8x exit or an 8 times return for a private equity firm that you're ready to go run the show. Like, go lead strategy, or go run a sales team, and then go run operations and go run product management and progress your way through it. It really will benefit you when it's your time.
You're basically making a pitch for empathy. You want people to understand from the bottom up how it functions.
Yeah, let me close off one point, because if somebody's listening to this, I don't want them to think one thing, which is empathy as a patient doesn't count.
Right.
So I've worked with a lot of startup and entrepreneurs where they come in, they had this medical experience individually, personally, whether with themselves or a parent, and that motive inspired them to get into a business. And I have seen that work, but I've seen that work because that person teamed up with somebody that had not skipped steps. What I haven't seen work is somebody just purely running on that pure drive as coming just purely from the patient perspective. Because my dad was a hospital operator, and he taught me really early when I was going to be the job. He said, look, son, when you're a hospital operator, the number one client is actually the physician. He's just, you're not supposed to say that, but that's really it. But here's the beautiful thing about that is good physicians attract good nurses, and nurses really deliver care. And so if you really care the most about patients, go get great doctors, have a great relationship with them, build an environment where your doctors are nice to nurses and attract great nurses. Get great nurses and deliver good care through that way, right? And so that's a business operation perspective that to impact patient care, it's all the people that are delivering care you really got to focus in on. And that's another example that empathy, like if I hadn't had that dialogue, which I was blessed was, in my own home, you could really miss the boat. You could raise $100 million and not miss that, right?
Absolutely.
So.
Well, Paul Joyner, CEO of Kipu, thank you so much for taking time out of your busy day to join us on the podcast as the inaugural guest.
Yeah, thank you.
This was an amazing conversation. I could go on for a while. So I hope maybe we can get you back at another time. But I really, really appreciate it. Your insights are invaluable, and we'll look forward to ongoing conversations. Thank you so much.
Well, thank you very much. No, thank you. I enjoyed it, and I'll be glad to come back.
Thank you.
Thank you.